Snow and ice, and cars passing too fast. I'd made this drive from Calgary to Edmonton a few weeks ago. It felt like I had just returned home when I received another call from my dad saying, "Mom is on the way to emergency. Can you please come?" Anxiously, I grip the wheel tighter and carry on. I became actively involved in my parents' medical life a few years ago when my dad had a minor stroke and lost his driver's license. Shortly after that, my mom was diagnosed with vascular dementia. They had always been generous and kind and constantly giving throughout their lives. Now they were the ones that needed help, and I was going to be there for them. My mom and I had become exceptionally close, spending time in hospitals, doctor's office, cleaning, grocery shopping, or just sitting at the kitchen table. It was hard to watch her become unable to cook and bake and have people over. During one visit, I was sitting at the kitchen table watching my mom take her medications. She would take one pill, swallow, pause. Take another one, pause again. Take a deep breath, swallow another, and on and on and on. Exactly how many pills is she taking? I dumped all her medications on the table and counted. 9 for breakfast, 5 for supper, and 2 at bedtime. 16 pills a day. How helpful are those pills, I wondered. I was concerned about the number of medications she was taking, but my to-do list was always too long to follow up. A few months later, I started volunteering as a family and patient advisor for the Seniors Health Strategic Clinical Network with Alberta Health Services. Honestly, I wasn't there to help Alberta Health Services as much as I was there to find out more information to help my parents. As part of the team, I was asked to attend a meeting with healthcare professionals from across Alberta to discuss the problem of medication overuse with seniors. For most of the meeting, I didn't know what they were talking about. But I remembered that morning watching my mom struggling to take her breakfast medication. This time, I was really going to do something. My parents had moved into a seniors lodge in Calgary and got a new doctor. I thought this might be my opportunity. At the next appointment, I told him about my SCN work and asked if he would do a medication review for my mom. His reaction surprised me. Those committees don't know what it's like to be an on-the-ground doctor. Seniors need their medications. We just can't quit them all. Well, I wasn't sure where to go from there. Thankfully, 2 weeks later, he said, "I've been thinking about it and you're right. We should do the med review." I felt so grateful that he had heard me. Together with the doctor and the pharmacist, reviewed all the medication and other health products my mom was using. It was overwhelming. We found that she was still taking medication for a short-term problem she experienced years ago and had never been told to stop. We found 6 medications where the risks of taking them outweigh the benefits. And we found that some medications were simply to fix other side effects. We knew we couldn't just stop her medications, so we made a plan. And slowly and surely, we decreased her medications by more than half. So many of her side effects like constipation, leg cramps, dry mouth, acid reflux disappeared. Our monthly costs went from around $200 to $40. And most importantly for me, Mom started being able to live again. With dementia, I know her needs will be constantly changing and we will continue to review her medications. Caregiving is still difficult, but now when I travel to Edmonton with my dad to visit friends, we rarely take Highway 2 anymore. I take the back roads. I see the mountains and the seasons changing. I count the hawks in the spring and watch for deer and coyotes. I can breathe.